All right, welcome to a very special Facebook Live edition of the Exam Room Podcast, brought to you by the Physicians Committee here at the International Conference on Nutrition and Medicine 2019 edition. And I am joined by Dr. Baxter Montgomery. Sir, you have credentials for days, but let's go with two. You are the medical director of the Montgomery Heart and Wellness Center and the founder and president of the Houston Cardiac Association. With that, welcome to the show, Doctor.
Thank you very much. Thanks for having me.
Are you enjoying your time here so far? I know it's just day one, but you look around, we've got like 1,000 people here from all over the world just talking about preventative medicine.
It's a wonderful conference, and I've been here a number of times before, and every time I come, it's just getting bigger and more fabulous. So, kudos to PCRM and Dr. Neil Barnett and such a wonderful job that they're doing here.
Now, for the people who aren't familiar with you, you are a cardiologist, and you are a plant-based cardiologist based in Texas. And when I think of Texas, I think of meat and a barbecue.
That's right. We like to consider Houston the barbecue capital of the world, and so meat is pretty important. There's a lot of influence in the southern states. People who relocate from Louisiana are very heavy meat eaters, and seafood and beef and pork and all these things are pretty prominent in the diet of Houstonians. And
given that environment, how much of a challenge is it for you to kind of disseminate this information, this research on plant-based nutrition?
It's interesting because one would think that it's very challenging. However, because the diet there is very rich in meat and processed carbohydrates and high-fat foods, the disease prevalence is relatively high as well. So when you have individuals coming to see me as a cardiologist with advanced heart disease, advanced diabetes, advanced hypertension, then they are motivated to make changes.
Right.
And many of them are on many medications, are threatened with surgical procedures, who've had surgical procedures, and who are suffering. So to the contradiction of what you may think, it actually makes it easier because patients are often sicker, especially in my situation.
Are the patients surprised after they have had this heart attack? I ask you this question because I was speaking with Dr. Robert Osfeld yesterday about this very thing. Nobody wants to have a heart attack, but is there kind of a defeatist attitude for your patients who have suffered one and they think it's kind of doom and gloom and, history's already been written and there's not much that they can do at that point?
That's correct. Well, not only with heart attacks or heart disease, but diseases in general. Often we see individuals who become accustomed to having disease, and so the disease state is the norm. And it's also a feeling in the general public, to have high blood pressure, diabetes, it's the norm. And so oftentimes people become settled with their disease and accepting of the disease when they have no other alternatives or think they have no other alternatives.
Right. Before we go on, we're going to talk about your wonderful program down in Texas. But if you have a question for Dr. Montgomery, please go ahead and post that below, and we will get to as many of them as we possibly can during this segment. You actually developed a program down there. Walk me through this. What is the patient experience there?
Yeah, so we use a food prescription for treatment of our patients as an integrative therapy for our patients with advanced heart disease and other chronic illnesses such as diabetes and hypertension and the like. This approach evolved over our initial interest in wellness and helping our patients get better in a more global perspective. We tried a number of different dietary interventions over my career, and we started using a plant-based diet over 15, 16 years ago. And personally, I started doing things like juice feasting and cleansing and saw remarkable results. We started applying these approaches to our patients and saw amazing results. Now, these are patients who were coming in who were had a history of bypass surgery, who had ejection fractions in the 10 to 20% range, with normal being 50 to 55% or greater. These are individuals with advanced diabetes who had diabetes for a long time. So we were reversing these illnesses or helping them reverse their illnesses in a very short period of time, days to weeks. And we were able to wean medication. So we made it our business to implement this approach in a more standardized way in our practice. So we started bootcamp classes. We even went to the point of building a restaurant on site that has meal plans, and we literally prescribe food, because when you put someone on a healthy plant-based diet, there are certain restrictions, so it's not enough just to eat plant-based. It can't be overly processed and the like. So we found that we were putting our patients on these diets. However, they may have gone out and got some vegan junk food. So we had to be more precise, and so we had to design the food. So we have a full-scale restaurant, plant-based. We have a food classification system. We've actually published the results of our findings, of our clinical findings in the medical literature.
Do you find, since you've instituted that restaurant, that you're seeing greater patient adherence to that menu, that dietary, that prescription that you're giving?
That's exactly right. So what we found is that, and we published this. We had a group of individuals with high blood pressure and hyperlipidemia, and we put them on the 28-day meal plan. We provided all the food for them, and we saw an 87% compliance of that.
Wow.
Now, that 87% compliance is in the background of a very strict compliance criteria. So in other words, you have one bite, one drop, one crumb of anything off the diet, that's a non-compliant day.
Hardcore.
So that's a very stringent compliance criteria, and despite that, there was an 87% compliance on that regimen.
Let me ask you, why is it that you're so strict with that diet? And I'll tell you why I asked that question after I get your answer.
Yeah, and so I like we get that question and the word strict, and I like to turn that to the word precise. So for instance, I said it's not a bite, not a drop. You have to be 100% compliant, not 99.99. So when the patients ask me the question similar to what you asked, I'll say, well, if I'm going to implant your defibrillator or pacemaker, do you want my gloves 90% sterile or 100%? So when they see it in that context, then we know the importance of being very compliant with the diet. That's number one. Number two is that we have to understand certain foods that we consume that are harmful to us are foods that we're in fact addicted to.
Right.
So whether it's baked chicken or baked fish or whatever the case may be. So if you consume these foods in moderation, you will always consume them in increased amounts over time because you're addicted to it. So you never tell an alcoholic to consume alcohol in moderation. You said not a bite, not a drop, not a crumb, or in that case, not a drop. But the point is that you have to be very precise in your nutritional regimen because you're dealing with biochemical effects of food and you're dealing with the addictive nature of foods.
I am so happy to hear you say that because I used to be 420 pounds.
Wow.
I understand.
I never would have.
I understand food addiction,
yes.
and it is very serious. I
yes.
look at food the exact same way you were talking about. It's
yes.
It's no different than any other drug. I talk
That's
about
right.
that a lot on this show. It's
That's right.
It's the same as cocaine. It's the same as nicotine. It's
That's
the
right.
same as alcohol. Any vice. It's exactly the same.
Yep. It's the same biochemically, but socially it's worse because those addictions are supported by society.
Right.
So nobody supports a crack cocaine addiction. Nobody supports an alcoholic addiction. But our society supports baked chicken addiction or
Yep.
bacon addiction. And so those are the most harmful addictions because there's social support for those addictions, and that's the problem.
Right, and what the hardest part, though, is getting people to understand, even if they are morbidly obese, super morbidly obese, that food is an addiction.
That's
we
right.
just don't view it in that same light.
That's exactly right. And even the thin people
Exactly.
are addicted to these foods who have high blood pressure, diabetes, heart disease, and high cholesterol.
Right.
And so regardless of their body habits, the bad food consumption is a problem.
Yeah, it really, I would go through physical detox if I
Yes.
didn't I was addicted, Taco Bell was my vice. I talk about that a lot too.
Yeah.
If I didn't go to Taco Bell, I would literally feel ill.
That's right.
Start to shake. It was kind of like watching somebody go through any other detox.
That's right.
I can't say that it was as severe as coming off an opiate addiction or anything like that, but what I can say is I was not a very pleasant individual to be around.
No, what you point out is correct. And our patients, when we put them through a detox, so we'll see a typical patient coming in on maybe 10, 15 medications that have multiple chronic illnesses. And when we start their detox, we see them in the office weekly. So, and we wean the medication, so it's a very intense program. It's not a willy-nilly eat plant-based and I'll see you in a month or two. We follow them very closely. Sometimes I see them maybe the day after, 2 days. So we do very frequent visits. We may see someone anywhere from 5 to 10 times within a month's time in terms of detoxing them, following them, weaning their medications.
That's so important, and I'm sure that some people struggle more than others, man, but
That's right.
I'm really happy to hear that the adherence rate is 87%.
Yes. And you have a supportive program. Oftentimes people will come in, our patients will come in, and they seem overwhelmed by the task of, you mean I can't have this for the rest of my life? So what we do is we say, don't worry about the rest of your life. Let's worry about 4 weeks. And so let's give me 100% for 4 weeks, and then after that we talk. What typically happens is that high success rate for 4 weeks. We can even go 6 or 8 weeks. However, after that, we typically see people who will, quote unquote, fall off. And we expect that. However, we have them do intermittent detoxes over time. So that intermittent detox effect over time has a progressive change, creates a progressive change in the taste buds, food desires. So there's a psychological change that we're noticing.
Sure.
And so they're able to adhere to a healthier plant-based diet over time, and it becomes easier. What we tell our patients and clients is the following. It's not a matter of willpower over time. We're trying to get you to change your food desires.
Yep.
And so that's the therapy. It's not the treatment of your hypertension, your diabetes, your heart disease. It's the treatment of your lethal food desires that we're trying to address first and foremost.
And let me tell you, I've talked with so many people who are trying to lose weight and, say that they're game and they're gung-ho for it. I've had people go so far as to ask me, well, what if I just, get a combo meal at McDonald's and just chew it up, but I spit it out before I eat, swallow it. That's food addiction.
That's right.
Have you had patients like that?
Well,
that's
yeah, we've seen that. They've asked, can I juice the meat? Can I,
Yeah, man. Yeah, it's wild.
Yeah.
And that it goes back to the food addiction.
Right.
People just don't equate food in that. But then you think these people are going to the same lengths to try to get that fixed. Well, then think about this, right? This is a little bit extreme, but think about somebody that's trying to cover, a drug addiction and is shooting up between their nose or in their wrist and letting the watch cover those track marks,
And that's the important thing. And so I go to the point of telling them, if a piece of meat or oil or fat from animals touch your edge of your plate, you throw the plate away.
Yep.
Don't let it touch your fingernails. So you have to push in the other extreme to help them break that, because they want to have just a little bit of edge. Can I have a little bite of this every now and then? Can I chew it and spit it out?
Yeah.
Can I lick it? And so I go to that extreme. You don't even think about it because that helps you break that addiction.
Man, you are the first doctor that I've spoken with that gets it 100%. Listening to you, the old 400-pound me is just listening and being like, he gets it. You absolutely get it. And that's so critically important.
Yeah, I get it. My patients over the years have taught me. So one patient I had, and it was a gentleman that actually was doing some IT work for us. He was in the office, feeling bad. We checked his blood pressure very high. So we, worked him up, and we said, okay, you need to get on this plant-based diet in addition to other things we're doing. So he started on the diet, and within, I think, midway into the second week, he was driving by Popeye's Chicken. Popeye's Chicken is, I don't know if your listeners know.
Love that chicken from Popeye's, or so they say.
Exactly. So big in the South and so on. So anyway, every Tuesday they have a special. Tuesday special, 99 cents for Popeye's Chicken. So anyway, he was driving along, and subconsciously he drove into a Popeye's Chicken parking lot.
Wow.
He parked his truck, got out, and he started walking into the Popeye's Chicken. So he's telling me the story. So in his mind, he's hearing voices. You should not be here. You should not be here. You should not be. And he's walking into the Popeyes. The voices are getting louder. You should not be here. You should not be here. He's in line waiting to order, and the voices overtake him. He turns around, leaves the Popeyes, gets in his truck, and starts crying out loud.
Yep.
And that, he says, I'm not even an emotional person, but that had an emotional effect on him. And I've had very similar stories from other patients. People have an emotional attachment to food that amounts to an addiction.
Man, I could talk to you all day about food addiction. So let it be known, sir, I'm extending an invitation to you to come back anytime.
Okay.
I feel like before we wrap this up, I need to take at least one viewer question from Facebook.
Sure.
Somebody writes, is it possible to eat too much fiber on a plant-based diet?
Wow, great question. I have not seen anyone eat too much fiber on a plant-based diet. I have my patients complain about how much they have to chew and how sore their jaws get. And so I'm going to say no to that based on my experience. However, I imagine somebody else may have a different experience. But I've not seen anyone eat too much fiber on a plant-based diet. Their jaws tend to wear out first.
Yeah, right. And that was a quick answer, so we'll end with this final question. Should vegans take an EPA or DHA supplement?
You know, that's a great question. We do supplementation on an as-needed basis. There are many vegans who need to take those supplements. There are many non-vegans who have to take those supplements. But we measure, those levels first. We do extensive blood tests. We measure for intracellular nutrients and phytonutrients and minerals. And we supplement in a targeted fashion based on someone's deficiency, because deficiency is not only based on consumption, be it adequate or inadequate, but it's also based on the body's condition. So someone may have a burnt out adrenal gland, for instance, and due to the fact they're not resting well or whatever the case is, and that mineral metabolism may be off. And so you may have to supplement magnesium or other things. So we supplement based on measurements of levels, and we do it in a target fashion.
Dr. Baxter Montgomery, I can't wait to have you back on, because I feel like you and I, we got a bond now,
Can't
sir.
wait to come back.
We got a bond.
Look forward
Thanks so
to
much
it.
for
Thank you very much. All right.
This has been the Exam Room Podcast by the Physicians Committee.